noticed some blood in my stool, and so I thought, you know what, it's time to be a grown-up, go to the doctor and find out what's going on. Basically, I ended up at Kendrick because of a referral, and I remember him telling me, don't know what's going on, but if I had any kind of an issue, these are the people that I'd go to. The first thing the doctors wanted to do was colonoscopy. Had a colonoscopy done, and they were very straightforward and said, yeah, you've got a cancer, and you've got a rectal cancer. It's still kind of tough to talk about. It was a little bit of a shock. I think any normal person's going to hear they've got cancer, and they tend to think the worst at the beginning. And the cancer that I had was one of the most highly curable cancers if it's caught early enough. And from there, it was it was kind of a whirlwind of activity. They wanted to know right away how much how extensive it was, what maybe it had spread to where it hadn't, what they were dealing with. That's the only way they could really treat it. Once he laid out a game plan, told me what to expect, what was going to go on, I was like, well, that's what we're doing. I had 6 weeks of radiation therapy prior to the surgery, and I remember talking. We had right before the surgery, we did an office visit, where they were making sure everything was the way everything was lined up the way it was supposed to be, and the radiation did a wonderful job. It shrunk the tumor to almost a minuscule, almost completely. And I remember asking them, why do I have to have the surgery? And he said, well, we don't have enough data. In 10 years, maybe we will have, and somebody in your position wouldn't have to go through surgery. But right now, this is the protocol, it's what we've got to follow. They wanted to do a procedure using the Vinci robot, and they explained the difference between the two of them. The standard procedure that they usually would have to use if they didn't have the robot available to them was going to be a much larger incision, was more than likely going to require that I'd end up with a permanent colostomy as opposed to potentially not having to have a permanent colostomy. The amount of recovery was going to be much more extensive. Just the amount of damage that would be done to my body was going to be a lot higher. They were going to use the Vinci the robot to do the procedure in a laparoscopic manner, and to me it was a no-brainer. I don't recall the pain being all that bad. I was in the hospital 4 days, 5 days, 4 days or 5 days when I had the first surgery. I was in for 3 days after I had the reversal and the ileostomy. For the most part, I don't experience any residual effect from any of that. My advice would be, if you think something is wrong, listen to what you feel might be going on, and do something about it. It's important to not ignore certain things, and I'm just really thankful that I didn't ignore that particular sign that I got.